Hi, my name is Jordan, and for my Psychology 477 media component of my project, I will be talking about the recommended amount of sleep for children. Sleep is a circadian process that is very important in our everyday life. It helps maintain proper energy levels, cognitive functioning, as well as promoting learning and memory. Sleep also can lend itself to social skills, creativity, and problem solving. It has been very widely studied, however, there still remains some debate on the proper amount of sleep per night, especially in children. What we do know, though, is that it is an essential process that helps with our immunity, health, and cell restoration functions. Sleep takes up about one-third of our day and has persisted throughout evolution, highlighting its importance. Brain neural circuitry regulation and adapting to an ever-changing world are key functions of sleep. Poor quality or quantity of sleep can lead to impaired memory and cognition, low energy levels or fatigue, as well as mood problems. Lack of sleep means an increased chance of getting sick and increased illnesses. Obesity, poor immune responses, and mental health problems such as anxiety and depression may also arise. Sleep is very important in the cognitive growth and development of children, especially at 6 months of age. At this time, children's nervous systems are still developing, which requires a large amount of energy and relies heavily on the restorative processes of sleep. Young children therefore need the most amount of sleep, but this amount will decrease as they age. It is important that parents start to set good bedtime routine and healthy habits in their children so that once they enter school age, they are sleeping consistently through the night. A recent report found that the total amount of sleep obtained by children has significantly decreased over the last 24 years. On average, children now are getting 0.71 minutes less per night every year. This can lead to academic struggles and behavioral issues. Cultural factors, genetics, and environment all influence and play a role in the amount of sleep that children get. A staggering 35% of children do not get the recommended amount of sleep per night. Newborn babies 0 to 2 months do not yet have established circadian rhythms and no diurnal or nocturnal behaviors. The average recommended sleep for this age group is 14 hours a night, including naps. As children start to develop their circadian rhythms and consistent patterns, they need 11 to 14 hours a night. Toddlers will sleep less than infants. They are now more active and engaged in activities, which challenges sleep and bedtime routine. As they become older, children that are aged 5 to 13 need about 10 hours of sleep per night. Sleep and obesity are correlated in children, such that low or poor sleep leads to an increased risk of obesity. Increased distractions and nightmares all cause difficulties for parents as they try to establish bedtimes. As they enter school age, this is a critical period to set good habits and routines. Therefore, maintaining a healthy 10 hours of sleep per night will lead to a greater chance of academic success, overall health, and lower behavioral problems. Getting good quality and quantity sleep is essential. In conclusion, children all need different amounts of sleep depending on their age. Infants will need 12 to 16 hours a night, toddlers will need 11 to 14 hours, and children 5 and up will need 10 hours of quality sleep per night.